Good afternoon. Welcome to the Nurse's Corner with your nurse TANEISHA COLQUHOUN. Today we are going to be talking about infectious conjunctivitis, otherwise called pink eye. Before we go further, according to the Merck Manual of Medical Information, the conjunctiva is the thin, transparent lining that covers the back of the eyelid and loops back to cover the sclera, and the sclera is the white part of the eye. Now, pink eye is inflammation of the conjunctiva caused by viruses, bacteria, or fungi. A variety of microorganisms may infect the conjunctiva. The most common organisms are viral. Bacterial infections are less frequent. Both viral and bacterial conjunctivitis or pink eye are quite contagious. It is easily passed from one person to another, or even from a person's infected eye to his uninfected eye. Newborns are particularly susceptible to eye infections, which they acquire from organisms in the mother's birth canal. So their eyes can become infected whilst they are being born. Severe infections may scar the conjunctiva, causing abnormalities in the tear film. Sometimes severe pink eye spreads to the cornea, which is the transparent part of the eye. Symptoms and diagnosis. When infected, the eye sometimes feels irritated, and bright light may cause discomfort, a lot of discomfort. The conjunctiva becomes pink from the dilated blood vessels, and the discharge appears in the eye. This is why we call it pink eye. That is the most distinguished symptom of it. Often the discharge causes the person's eye to stick shut, particularly overnight. So whilst they sleep, the discharge just keeps their eyes shut. This discharge may also cause the vision to blur. Vision improves when the discharge is washed away. If the cornea is infected, vision also blurs but does not improve with washing. Very rarely, severe infections that have scarred the conjunctiva lead to long-term vision difficulties. Prognosis and treatment. Most people with infectious conjunctivitis eventually get better on their own. However, some infections, particularly those caused by some bacteria, may last a long time if not treated. Inclusion conjunctivitis persists for months at a time. People with conjunctivitis should gently wash the eyelid with tap water, clean tap water, and a clean washcloth used to keep it clean and free of discharge. Cool compresses sometimes soothe the feeling of irritation. Because infective conjunctivitis is highly contagious, a person should wash his or her hands before and after cleaning the eye or applying any drug. Also, a person should be careful not to touch the infected eye and then touch the other eye. Towels and washcloths used to clean the eye should be kept separate from other towels and washcloths. People with infectious conjunctivitis generally stay home from work or school for a few days, just as they would with a cold, because conjunctivitis or pink eye, it is very, very contagious. Antibiotics are helpful only in bacterial conjunctivitis. However, because it is difficult to distinguish between bacterial and viral infection, doctors often prescribe antibiotics for everyone with the pink eye. Antibiotic eye drops or ointments that are effective are used for 7 to 10 days. Eye drops must be applied every 2 to 3 hours because the drug is washed away by tears. Ointments last longer and are applied every 6 hours, but these blur vision. Therefore, they always recommend that if you have pink eye and using the ointment, you should not do any such tasks such as driving because it tends to blur your vision for a while. That is it today for pink eye or infectious conjunctivitis. Before I go, I would like to leave with you the health tip for the day. The health tip for today is, it is not about being the best, it is simply about being better than you were yesterday. Again, it is not about being the best in anything that you do. It is simply about being better than you were yesterday. Again, I'm TANEISHA COLQUHOUN and thank you for listening to the Nurses Corner. See you again right here on Tops Radio, same time, same place, where we will be discussing another health topic. Have a wonderful afternoon, my Tops family, and remember, healthy living is not a goal, it is simply a way of life.
Tops Radio and Associates take no responsibility for the opinions or statements made by the host or their guest. Statements or show topics are not necessarily the beliefs of this site or this radio station. It's not our intention to libel, discriminate, make hate, or annoy anyone. This site or radio station takes no responsibility for the opinions of others in the postings of comments in chat rooms or forum posts.
Gentlemen, the number one station. The number one station.
It's always hot.
Tops Radio.
It's always on.
Big Bad.